According to the World Health Organization, 1 in 3 maternal deaths in Kenya occurs due to excessive bleeding or postpartum hemorrhage. Health workers at the Malindi sub-county hospital in Kilifi have developed a gadget that allows them to measure the amount of blood lost during childbirth and diagnose postpartum hemorrhage in time to prevent death.
We made a drip made of Macintosh, and we had a container, the bowl that is under the bed. We had it graduated so that we can estimate blood from that. We had it have several graduations that replicate what was in the drip, and it was easier now for us and the midwives to pick out what amount of blood the patient had lost so that we know what drugs to give and in good time.
Before they developed the device, medical staff and midwives would estimate blood loss using the naked eye, leading to frequent errors and in some cases, death. But in 2022, the hospital was selected to pilot the e-motive technology funded by the World Health Organization.
So we developed an intervention called e-motive. E stands for early detection of postpartum hemorrhage, and we use a calibrated plastic bag to collect all the blood, so we know exactly how much blood is lost. And if a woman has lost too much blood on that accurate measurement, then we give a bundle of treatment called motive, and that has got drugs in it like oxytocin, like tranexamic acid, but also other steps which would improve the outcome for the patient.
The gadget was a game changer, but when the program ended, the hospital lost access to the technology, necessitating its own invention. Unlike the e-motive technology, this drip is reusable. The device has benefited more than 6,000 women who have given birth at the Malindi sub-county hospital, which handles 80 to 100 births every week.
We are still able to diagnose postpartum hemorrhage quite early, and with that we have seen a reduction in the number of mothers who we are having very bad we used to previously have very bad outcomes for. So initially we'd have to struggle with trying to look for blood to transfuse these women. Some needed who had developed acute renal issues had to be dialyzed, and some needed ICU care, and some were lost. So now we've seen a reduction in that. We are transfusing less mothers because now we can quickly manage postpartum hemorrhage in good time.
The facility is now spreading awareness among community members to encourage uptake of the technology. Muriel Adhiambo, K24, Nairobi.